this is a case of a nasal pinguecula, I first take a stitch at the opposite limbus in order to see the entire extent of the pinguecula, intralesional anesthesia to delineate the entire lesion. After removing the pinguecula, I use a wax cell sponge with epinephrine for hemostasis as well as subconjunctival cleavage. Remember to get to the roots of this lesion and remove the entire mass. Smoothen the limbus with a 64 blade along with the adjoining sclera. Be very meticulous here and take your time. Remove all the slivers of subconjunctival tissue and any pinguecular remnant from the sclera, as well as smoothen the limbus to your full satisfaction. Accept the amniotic graft, epithelial side up. Using the tire tool technique that I've described before, holding the conjunctiva with two forceps, guide the amniotic membrane atraumatically so it slips under the conjunctiva and over the sclera. Squeegee it in two movements, using the first component of the tissue glue in a very controlled, minimal fashion. Sweep in one direction and then in the other, so the graft is nicely adherent to the sclera, as well as sweeping all the way under the conjunctiva. Second component of the tissue glue, again in a very controlled, minimal fashion, and sweep it out to an even distribution with pressure on the sclera. Remove excessive glue from the conjunctiva and from the fornices. Using the same blade, trim the amniotic membrane exactly at the corneoscleral limbus for a great aesthetic appearance as well as ability to literally wear a contact lens next day. Using this 2XL technique, squeegee the graft down to the sclera as well as get a good physical feel for how well the graft has adhered to the sclera. We haven't had a single case of slippage following this technique. Again, take your time. So this is the immediate post-op appearance. Clear cornea, smooth corneoscleral limbus, completely clear sclera. Remove the fixation suture. High magnification image. Antibiotic steroid drops. Look at me. I'm looking at you right away. First day post-op. Looks fantastic.
It does.
Right?
Thanks.
That's good. Go up to the mirror.
Oh my gosh, it does look good.
Oh my gosh. You can't even tell. That's amazing. That's really amazing. Thank you. Oh my gosh. All right. Thank you.
It's like it was never
Yeah,
there.
it's like it was never there.
It was never there.
No, but what we're seeing is the membrane, right?
It's so clear and just...
So I'm going to need to be very, very careful. Right, I totally understand.
She wants to do
You know.
everything.
I don't know. She likes
Everything.
Yeah, see, okay, there's the before. That nasty thing.
this. Is
Oh my goodness, yeah.
So, Jessica, everything went very well.
Thank you.
Today's your first day. Your eyes look absolutely great. And be careful. Remember what I like to tell all my patients: baby the eye.
I will.
Okay?
I will.
Have a safe drive back home to
Thank
South
you.
Florida. And call me anytime with any questions.
I appreciate that.
All your instruction with drops we have gone over with you and your mother. Any questions for me?
I don't think so. You've been very helpful.
Congratulations.
Thank you so much.
It's a pleasure. Yeah. Okay?
Hello, my name is Jessica Pate. I'm a first grade teacher in South Florida and suffering with pterygium in my left eye, growing over into my cornea. And I did a lot of research because I knew that I needed to have it removed at that point. I've been living with it for about 4 years and it was time to do something about it. So I did my research online and I found Dr. Gulani and I drove 4.5 hours to come visit him with my mother-in-law. And from the moment we walked into the office, the staff was extremely professional and friendly. Dr. Gulani was very helpful. I was a little nervous about going into surgery, but I was relieved to also find out that I was under full anesthesia, so I was completely asleep. Woke up, felt fine, minimal pain, slept great last night, just woke up this morning, and about 15 minutes ago Dr. Gulani took the patch off my eye, and this is what you see. I am thrilled. I couldn't have expected any better results. I feel good, I'm very happy, and I can't wait to have the other eye done, maybe in a month or so.
My name is Patty, and I am Jessica's mother-in-law, and I am so thrilled and thankful to see what Dr. Gulani has done. I have seen the progression of her eye and been so concerned about it for so long, and of course anything involving the eye, the apprehension is so great. From the moment we entered this office, the staff was so incredibly helpful, comforting, educational. Dr. Gulani, every doctor should take notes from Dr. Gulani on how to make his patients know
Feel
what
comfortable.
great care that they're having. The result, I never knew that it could look like. It is so beautiful, so perfect. The very next day, there is absolutely no evidence that there was ever anything. And hers was very advanced, very deep. So we are so thankful for Dr. Gulani
Thank you,
and
Dr.
his staff.
Gulani.
Thank you. We want to take you all home with us.